Hello, my name's Lynn Bunnell, and I've produced and narrated an online course called Travel Health 101 to introduce healthcare providers to the practice of providing pre-travel healthcare for international travelers. I began counseling travelers in the early 1980s, first in travel clinics and then later in a large New York corporation. And I've taught providers how to provide pre-travel care for the last several decades. So the subject matter is very familiar to me, and I enjoy passing it on in a conversational way that's easy to follow. I update the course yearly and on an as-needed basis in between major updates. When you sign up to take the course, you'll receive 2 months of access to the password-protected website from any computer. So you can study each section at your own pace, repeating any sections that you wish to for more effective learning. An added feature is that you can contact me while you're taking the course if you have questions. Upon completion of the course, you may qualify for a CME, CNE, or CPE certificate after you complete the post-test with a score of 75% or higher. Taking the course online avoids the need to pay for travel and accommodations, and it's very useful for training new staff members so everyone has the same level of knowledge on the subject matter. Since the course went up online in 2009, I've received many positive comments from healthcare providers who took the course. They felt that the content was exactly what they expected. I've included a handout file for each section of the course, which you can print out or save as a file for future reference. That way you can make notes about what you want to study more or the important things you want to remember as you start seeing patients. The course includes the following sections. There's an introduction to the practice of providing pre-travel health care. There's a section called Health Risks Around the World that reviews geography and some of the diseases that occur in specific areas of the world. And then there's a section about pre-travel risk-based patient assessment, which reviews issues related to the traveler and also to the destination. That's followed by a section reviewing the various vaccines that you would consider for your patients, the rationale, the series, and so forth. And following that, there's a section on vaccine administration considerations. Then there's a section about malaria and other insect-borne diseases, not all of them, but the most important facts. And a good section on counseling travelers, how you teach them and what you need to teach them pre-travel. There's a section that reviews resources for further study and to look up information about particular case scenarios that will be helpful to you as you start seeing travelers. In addition to the case studies that I present at the beginning of the course, in the last section I review several more case studies. There's also a worksheet that you can print out and use as you go through the cases. So in summary, when you take this course, you'll learn about how to talk to patients about the details of their trip plans in order to identify their risks, how to gather the patient's health and immunization history. I'll teach you what's involved in creating a risk-based plan for each traveler, and I will review with you how to help the patient learn about which vaccines and prescriptions are needed for the trip. You will learn how to set out a vaccine schedule, which vaccines to give first, which ones you can give together, and how to plan for follow-up visits. You'll learn how to educate the traveler about how to stay healthier during travel and give them information about what to do if they become ill during a trip. And finally, I'll review the details of creating records for your clinic and also for the patient. To sign up for the course, just click the link on our website. And for more information, email us at info@travelhealth101.com.